we'll give the floor now, and you can tell about your experience.
Good morning. I would like to start with thanking a few organizations that made this possible. The Kidney Foundation from the Netherlands for financing my trip, and the EDTNA committee for inviting me on this day. My name is Vincent, and I come from the Netherlands to tell what Nocturnal Dialysis has done for me. Maybe first some important information, general information. Don't mind if I say something funny because I'm kind of nervous. And if you cannot understand what I'm saying, don't hesitate. Please don't hesitate to interrupt. My intentions with the presentation are to give you a clear picture of what nocturnal dialysis has done for me and how it could work for others. If you take a look at the slide, it might look like a joke, but I'm a bit serious because my objective is that the listeners after my speech can think about what it could mean for other kidney patients like me. Like the picture says, I'm kind of selling the product. And it's no scientific proof, of course. I will tell a bit about the following subjects regarding my presentation. I will start with the history, followed by the treatment I underwent, and closing what I've become so far. Any questions? The year I was born. And after my second birthday, my career as a full-time kidney patient started. My first job as a peritoneal dialysis patient started in 1990 because I got sick. After that, I got transplanted, and this gave me some time off. This was only for 2 weeks because I've been called back for more peritoneal work. It was because of rejection. Then, 1 year later, I was blessed with another transplantation. But after 1 month away, I was back on duty again, due to recurrent disease. Then it was quiet in my career, till 1997, when I started as a full-time hemodialysis patient, doing a part-time central hemodialysis. But this didn't make me feel any better. I struggled doing what I should at school and needed a lot of help to keep my head out of the water. It was made a little easier because of a new development. When I first did it in the hospital, 2 hours drive from my home and school was now possible at home. Like you can understand, this gave me a lot of useful time that I really needed at school. And I started making friends and looking at what I really wanted to do with my life. I was feeling a little better, but there was still room for improvement. Thanks to Dr. Krokos and Dr. Koista, I was able to start with a new project called Nocturnal Dialysis. Everything I was working for at the time became much easier because of this. So maybe a bit exaggerated, but I was kind of feeling like this when I started with my nocturnal dialysis. Because of the long-term program, I lost practically everything of being a dialysis patient, except dialysis, of course. With this I mean medication when eating, bad stamina, my diet, time on the road, of course, trouble learning, and much more. This made it easier for me to be good at some of my hobbies, like making music and take part in DMX competitions. Also, because of the Nocturnal project, I was able to start my nursing education and have a happy job working at the psychogeriatric hospital. And of course, eventually, go on vacation in Spain and talk about myself. This is where you can see how much progress I have made because of the Nocturnal project. What I first did 3 times a week in a hospital was then able at home and eventually flushed for me at night, which meant a lot of improvement. And finally, Professor Cole, my role model, what was he on fire again? And close with this last slide. This was my presentation. If there are any questions, I would be happy to answer them. I will try to answer them.
Both speakers for that, and especially Jason for the story. And I'm sure they're going to be questions. So we'll have the first question. Go ahead. Please take